friends, this is Joyce Mabel D'Souza signing in from Noras. Today we are here to deal with one more important topic as well as one life-threatening condition which is related to female reproductive system. This topic is regarding toxic shock syndrome. As there is a word called as syndrome, that means there is not only a one clinical feature or a problem, there are n number of problems are happening. As well as other two words are there, toxic, that means something poisonous material which is not good for body. And the word shock, there are multiple types of shocks are there where multiple organs are getting failure. Now, this toxic happens and there will be a shock which is related to this toxin or induced by this toxin. And finally, they are showing the clinical features. So, this is about just an introduction. Let me explain you what is actual meaning. So, meaning says that toxic shock syndrome is a multi-system failure. What is this multi-system failure? You have n number of systems, maybe cardiac, neuro, your respiratory, your GI, yes? Yeah. Now, in this all system, even your renal, your female reproductive, whatever it is, these all systems usually gets to fail when there is a toxic shock syndrome. And they says that it is mainly because of Staphylococcus aureus infection. This usually seen in the postnatal women. So as I'm telling, this is something relatedly mainly seen in the postnatal mother. By this time it would have clicked that this is obviously related to a female reproductive system disorders. Now we will see in detail what is the toxic shock syndrome. Now the definition says that this is a potentially fatal condition which is flu-like disease. So flu means there is a fever. And it is caused by the toxin which is mainly produced by a common strains of bacteria. Strain means a line of bacteria which is mainly spread into the bloodstream. Whereas another side they say that there is different bacterial toxins. So especially when and there are different number of toxins or the bacteria which is causing toxic shock syndrome or TSS, they will be depending upon the situation. And especially the causative factor, as I said, Staphylococcus aureus or Staphylococcus pyogenes. Now, this Staphylococcus aureus as well as pyogenes, which is normally found in the skin on the or in the vagina. So, automatically it does not produce any harmful effect when it is in the protection of a normal flora or in the normal condition. But what happened? In severe cases, they produce some of the toxins and these toxins or the bacteria is absorbed into the bloodstream and then finally causing the toxic shock syndrome. Now we'll see the risk factor. So obviously there are n number of risk factors. Due to that itself, this bacteria is getting triggered. The first one is age. Usually this TSS occurs at the age range of age between usually 15 to 24 and adolescent girls. Why? This is the age when they get to start a menstruation, or the menarche will start at this age around at the 15 or 16, and they will be trying to use many of the like a sanitary pads, tampons, vaginal cups, menstrual cups, all these things, varieties they are going to try in their life because of these irritations which they are feeling at this age. And sometimes what happens, there will be a chronic vaginal infections. This infection can happen because of many of the disorders, diseases, or due to the sanitary pads. whatever. If that is a chronic vaginal infection, obviously the toxins will be produced by the bacteria. Whereas in some people, if they have a poor personal hygiene, especially the perineal hygiene is not maintained. When the girls, when they attain or they get their menstrual cycle, they has to maintain a proper cleanliness or the personal hygiene, that is maybe regarding to their perineal area, as well as whatever the inner dresses which they are wearing, and the regarding the changing time of the sanitary pads or tampons. This is very important that they have to know it, and why this has to be changed within 2 to 4 hours. What will happen? What type of infection will be producing? What will be the problem for the skin? So that all things has to be learned by the adolescents or parents, teacher, guardians, or the health educators or the health profession people can educate the adolescent girl. Now, here in case if the adolescent girl or the females, they are not maintaining this hygiene, there is chance that they can get toxic shock syndrome. Other than that, they use some of the super absorbent tampons. So nowadays, as I said, there are many much more methods are there. When like usually in the olden days, I can say that there was only a cloth which was available, which woman used to use while she is menstruating. Now what happened? Then there is a sanitary pad came, varieties of numbers of sanitary pads were there, tampons are there, menstrual cups are there. I'm not telling that you don't use that things and go back to the olden days. I am telling that when you're using, you have to take some of the precaution. You have to keep something in your mind. When you're using these super absorbent tampons, there will be much more reactions with this tampon as well as your vaginal skin. That will be releasing some chemicals, or it will be one more exciting factors that bacteria can produce the toxins. Whereas some of the skin incision, especially episiotomy or any other surgery which has done in the vagina or cervix, as well as any surgical wound infections, also if that particular sterility is not maintained after the surgery or the cleanliness is not maintained over that incision, then there is a chance of getting toxic shock syndrome. As well as there are postpartum endometriosis. We have dealt a specific session on endometriosis. So instead of that proper endometrium going in the inner layer of the uterus, it will grow into some other places. So that is something abnormalities which we have dealt in the one session. Now here what happens, especially in the postpartum, that means the mother after the delivery is postnatal mother, when she is having her 40 days of first postnatal days, otherwise till the 6 months, we can call as that is a postnatal period. Now here what happens at that time, in case of some endometriosis is happening, that will be a one cause for your toxic shock syndrome. Next we'll see the etiology. The first etiology is Staphylococcus toxic shock syndrome. The word it says that there is a bacteria which causing TSS. Now here, the most common case of toxic shock syndrome is caused by the bacteria called as Staphylococcus aureus. Now, most well-known Staphylococcus toxic shock syndrome is also associated with the many menstruating women. Usually when they are using the tampon, they will get these type of Staphylococcus toxic shock syndrome. Second is one more Staphylococcus toxic shock syndrome. Here, mainly it is caused by Staphylococcus pyogenes, which I already told you in the introduction. Now, oftenly this comes in this with the skin infection, which is mainly a serious, and then it will be forming just chronic vaginal infections, chronic skin infection, which can produce toxic shock syndrome. Now we'll see the pathophysiology. By looking at this picture, you can see that there is one tampon as well as epithelial cells which is of vagina. There are chemical reactions are produced with the super absorbed tampons as well as the bacteria which is around at the lining of these tampons as well as your epithelium will start to reproduce and forms the toxins. Let us see in detail what is the pathology. Now, pathophysiology says that Staphylococcus aureus, which is usually found in the normal vaginal flora. What happens? This Staphylococcus aureus, which is mainly involved, and they will be producing some of the endotoxins, and they will be releasing some of the TNF suppressed neutrophil migrations. That means when there is an infection is happened, there will be a neutrophils, usually your white bloods, components of your white bloods, leukocytes. Okay, these will be migrating to that place wherever the infection is happening. And that time, the capillaries, that means the smallest blood vessels, their permeability will increase. Now, what is this permeability? Permeability means ability to pass through it. If the permeability is more, that means it is very thin, easily solute and solvent can pass through it. If it is very thick, then it is not able to pass through it. You can take an example how when you sauce your tea, if it is very thick, then you cannot sauce your tea properly. If it is very thin, you can very well see to that your tea is draining properly into the cup. Now here what happens, permeability is increasing. So as I said, solute and solvent both are moving. Whatever the inner solutions are there, or you can say inner fluids are there, they are going in the outer cellular. It becomes outer cellular fluid. It is moving from in to out. Now, when it is moving into out, that is called as extravasation of fluid. That means all the cell fluid is coming out. And there will be a decreased venous blood flow. That wherever the area is affected, there the fluid will be collected and venous supply going back to the heart is not happening. Automatically, the heart does not get a proper blood supply to pump or pure it. I'm not telling about anything related to the heart. Heart itself is not getting blood supply. That is different thing. Okay. Here what I'm telling is that venous flow is not there from superior vena cava and inferior vena cava, which is supposed to give the blood to the heart. That is only decreased. Automatically when heart is pumping, cardiac output also decreased and there will be a low blood pressure. And then the person or the affected person will show some hypoxia. That means there will be a lack of blood supply, or you can say that oxygenated blood supply. So due to the oxygen supply is less, there will be hypoxia. And there will be some of the renal as well as CNS, that means central nervous abnormalities can be seen. Next, we will see some of the clinical feature. As there is much more infection is there, first there will be a high temperature. So fever will be there and the person's temperature will be reaching always 1 or 2 degree Fahrenheit. As well as there is a skin infection, that means in your body, that Staphylococcus aureus and pyogenes, when they are releasing some of the toxins, they will be showing some of the skin rashes. And this skin rashes show some of the macular erythroderma. That means erythroderma is usually related to your erythrocytes, RBCs. There will be a small papules or small macules which are present in the hand or into the vaginal area, perineal area, and there will be a bloodstream infection. As once the infection has spread to the through the blood, the rashes can be seen anywhere in the body. As well as there will be a hypotension. As I already said, there will be decreased venous flow. Inferior vena cava is not giving the proper blood supply to the heart to purify. Heart also pumps out how much amount it got. So, cardiac output also is less. Automatically, low BP, hypotension will be there. And multi-system failure can happen. Many other organs, first they will be involved and they show some of the signs and symptoms, and finally they will fail. So, including, as I said, liver, renal, respiratory system, CNS system. And when it is getting affected to the renal system, there you can see that increased BUN. That means blood urea nitrogen. When you do the blood examination, you can see that increased blood urea nitrogen as well as serum creatine, which should be around 1.5. It will be beyond that. And there will be a urinary sediment that is also with the pyuria, that means pus in the urine. And when these features are there, but absence of UTI, urinary tract infection, that indicates kidney now it is going to fail due to some of the bloodstream infections. In case your hepatic system, that means your liver system is getting affected, then total bilirubin will be high as well as liver enzyme like your alkaline aminotransferase enzymes. These will be elevated. In the blood, you can check for the platelet, usually which will be less than 1 lakh. So, we need more platelets because we need to more coagulation should not happen. We need the platelet because if there is no platelet, bleeding will be more. And central nervous system is also getting involved and it will show some of the symptoms like a disorientations. Disorientation usually happens to the time, place, person. The person's central nervous system is such a state that he is not able to recognize the person, nor he can identify where he is, nor he is knowing about the time. That is called as disorientation. Whereas he will be also having alteration in the consciousness, sometimes unconscious or semi-conscious. Other than that, you can check for that without any focal neurological sign, head injury or any other problem. He is having these type of problem like a disorientation and loss of consciousness that indicates somewhere that the person is having central nervous problems and it may be due to bloodstream infections. Some of other signs and symptoms of toxic shock syndrome. High fever, I have told you, headache, there will be a throbbing type of headache, vomiting will be there, joint pains will be there, as well as low blood pressure. How you can diagnose whether the person is having this is the problem because he is showing multiple symptoms, syndrome, how we can come to a conclusion. Now here what happened, first you have to take the history collection. The female, when they are coming, ask them their menstrual cycle, their hygiene, and you will be asking about the history whether they are using sanitary pads, tampons or any other things. So by that you will collect all the history. Other than that, you can do a physical examination. You can also visualize the vagina and cervix, and you can do it with the proper use of vaginal speculum and inspect the vagina properly. After that, you can do a blood culture. So when I'm saying that some bacteria is producing some toxin, so you take a swab and you can send it to the lab. Along with that, you wanted to check whether that infection has spread all over to the body by a bloodstream. You take the blood and send it to the culture, and in the blood also, if you find the same toxin, then you can identify that this is due to a vaginal bacterial infection. Then you can do a complete blood count. In that, you can also check for TCDC ESR as well as your leukocyte counts, where you can get a clear picture. Along with that, you can do a platelet count also. Then comes renal function test. Renal function test includes all the electrolyte, serum creatinine, urea, BUN, all these things you can check and can identify what is the functioning capacity of your renal system. Same way, you can check for the liver function test. Along with the bilirubin, you can check for liver enzymes. So by that, you can identify whether liver is having any infection. And finally, you can do some of the imaging studies. So in the imaging studies, you can see there is abnormalities, as well as in case if the person is getting any ARDS, you can take a chest x-ray and you can find out. Or you can, in case of CNS problem, you can take a CT scan or MRI. In case of joint pain also, you can take an x-ray. So by all these clinical features, you find out and come to one conclusion. Now we'll see the treatment. It is very important that you should know the treatment because we need a aggressive shock management. So when I'm telling aggressive shock management, that means I need immediate treatment. That is because this is one of the life-threatening condition. And somewhere I need to maintain the fluid, somewhere I need to give the drug, somewhere I need to monitor the patient. So aggressive shock management has to be done. Along with that, you have to do continuous monitoring of the person. If there is a need of fluid replacement, that is also especially a bulk of fluid needed, at least 4 to 20 liters, as well as in case of need of crystalloids, you can also provide some of the frozen plasma. So blood transfusion also can be done. In case if there is a need of ventilator, you can make that person to get the proper ventilator management. And that especially when the person is developing ARDS, that means your respiratory distress syndrome, then only they will be giving the ventilator connections. After connecting the ventilator, you have to give a special care according to that. Then comes whenever the patient is getting treatment, in between we just wanted to check the prognosis. We will be doing a blood checkup, complete blood test we will do, as well as culture also we'll do regularly. Upon that, in case the female is having tampon inside, then you remove that tampon because it is super absorbent tampons. So you remove that tampons as well as anti-staphylococcus treatment. That means your high antibiotic like a penicillin or your cephalosporin. In that you can give that to anyone, you can give that to the patient and treat it. So antibiotics are playing very important role. Now treatment involves many things. As I said, antibiotics are needed to treat the infection. Along with that, you need some of the purified antibodies. Now these can be you will get from the blood donation. So this can be known as pooling of immunoglobulin. We need some of the immunoglobulin to fight against these antibodies. And in the patient's body, it is not there. That's why we are taking someone's blood. Their blood is much more capable to fight with these bacteria. They act as antibodies. And here, it will help your body to boost your fighting capacity or fight against the infection. Then comes, as the patient is having hypoxia, you need to give oxygen supply. So the oxygen supply can be given through the oxygen mask, or in case of your patient is already got any kind of ARDS, you have to take some of the special precautions, and oxygen can be supplied along with your ventilator equipment itself. Then comes fluids. So already I told you, fluid replacement as well as blood transfusion. This will prevent the person to go into a dehydration as well as organ damage. So preventing of the organ damage is also will be done by proper replacement of fluid. Next is, you have to provide medicines which has to help to control some of the blood pressure. That means if the patient is having hypotension, you have to see that patient's blood pressure has to come into a normal state, which you can mainly do it by your fluid replacement therapy itself. When you're connecting NSIV fluid itself, there is a sort of blood pressure will increase, and other medication you can give to control your blood pressure in case the blood pressure is high. Next management is dialysis. Whenever there is a symptoms that your kidney is going to stop, or there will be a much more burden to the kidney because half of its capabilities or functions are decreased, then it is better you start with the dialysis. So as kidney is stopping the function, dialysis is done through the machines, blood urea nitrogens as well as serum creatinine. All these, whichever the much more producing toxic items will be reduced and cleared by the help of dialysis. And the last one is surgical removal of the dead tissue. Now here what happens, we know that vaginal flora which actually produced some toxins, and that pleases due to the lack of oxygen as well as much more production of endotoxins, there will be a dead tissue, and that will be removed from affected area. Now some guidelines, especially the women or the girls who are using tampons. Now use the tampon which is very clean. Nowadays in the market you get a number of companies. See to that you are using these tampon into your internal organs, and that's why the sterility plays very important role. So that important role is in such a way that it will prevent the infection if it is from a good companies. So see to that you get these items from a good place. Don't go into a very local markets and buy these things, because sometimes these are not maintaining proper sterility, or the quality of the materials are not so good, which can easily attract the infection as well as produce the infection. As well as when you are trying to take these materials from the good company also, you have to read the instruction whether it is good for your body or not, then try to use it. One more thing, that whenever you are using the tampon, you have to change this tampon at least 2 to 4 hours. Then washing the hand is very important with the soap and water. Use a sterile pads, especially in the night, during when there is no need, you are not doing any social activities. So you can use these pads in the night, or you can use this tampon when there is a low flow is there. As well as along with these instructions, you have to remember that any of the surgical incisions are there around your perineal area, you have to see that you prevent the infection. See to that your healthcare provider, which she is able to notify any unusual swelling. Whenever you feel discomfort, you can go to the healthcare worker and you can show yourself. And you see to that any redness, heat which is near around that surgical incision, any wound, then they can able to recognize the symptoms called as infection. Then comes, you have to follow all the directions, which is especially with the female when they are using any type of vaginal contraceptives, as well as like a she can use such as sponge, caps, diaphragms and all. She has to be very careful and she has to use all the precautions which is given by particular companies. They will be asking that due to this time you can use, due to this time you cannot use, you have to insert on this time, and what is the validity. So all that you have to read, then you can use the contraceptives. And do not use any tampons at least for the first 6 weeks, especially in the postpartum period. Then those who are using the contraceptive, barrier contraceptives, they have to also take some of the precautions like washing the hands, as well as do not use any of the contraceptives, especially when you are menstruating, as well as remove, especially there will be a recommended periods are given when to remove these contraceptives. That time you have to remove it. Now, what is the survival rate for this toxic shock syndrome? They says that it is a life-threatening condition which can lead to the death. In 30 to 70% of the cases, there will be a chance that death will happen. But promptly when you are doing the diagnosis as well as treatment, you can say that there will be a best outcome. So we can say that prognosis is good when you are treating the shock. As well as this is one of the leading mortality case, especially when the patient is developing ARDS, acute respiratory distress syndrome, patient will go into a life-threatening condition. That's why we connect with the ventilator. Then, in case there is uncontrollable hypotension or DIC, that means disseminated intravascular coagulopathy, this happens, then there will be a prognosis is very poor. Now, what are the complications of toxic shock syndrome? So, toxic shock syndrome, which is a life-threatening condition, if it is not treated, then it will be showing some of the main organ failure is liver failure, kidney failure, your heart failure, as well as coagulopathy. So coagulopathy, where the signs and symptoms are mainly bruising or your prolonged time of bleeding, prothrombin time will be more, and there will be pinpointed rashes, purpura and all. So let us see one by one. The complication which is mainly occurring if there is a renal failure is there. So as I said in the diagnosis itself, diagnostic evaluation itself, there will be increased total bilirubin. The skin will be turning into yellowish color. That causes a jaundice. As well as there will be a like upper abdominal pain. Abdominal girth will be more as it is distended and some amount of fluid collection can be seen. And difficulty in concentrating in any of the things, the person will be having nausea, vomiting, diarrhea, confusion, dark urine because there will be a yellow color which is much more in the blood, and it will be filtered in the kidney, and the urine also will be in a yellow color, dark color. And the person will be having sleep disturbance. Whereas if the person is having kidney failure, he will be having fatigue, weakness, nausea, vomiting, as there is electrolyte imbalance, muscle cramps will be there, hiccups will be there. Other than that, there will be itching and chest pain will be there, abnormalities of the breath, blood pressure will be decreasing, or sometimes if the serum creatinine, sodium, it is reabsorbed, renin-angiotensin mechanism will activate and there will be a high blood pressure. And sleeping problem will be there, as I said, in the same case of liver failure also, and problem in the urinating, maybe difficulty in the urine or a burning sensation, uncontrollable urinating, along with that pyuria, pus in the urine. In case if these failures are happening to your serious system, cardiovascular system, heart failure is happening, then heart palpitation will occur. That means the heart beat will be felt by the person. And chest pain, wheezing, coughing, lack of appetite, you won't be able to concentrate in any of the work, and fatigue, weakness will be there, and there will be a foot will be swelling because venous tag. That means the venous flow back to the heart is not happening. Venous will stay especially below the pelvis. So, leg will be swollen and there will be a shortness of breath because there will be a more fluid collection. Kidney is also not filtering, heart is also not taking. So, all the fluid collection will be there. Patient will be having breathlessness. Then signs of coagulopathy. That includes, as I said, many things like a purpura, redness, rashes, chest pain. Then irregular heartbeat can happen, anxiety will be there, and the person will be having dilated pupil. As a nursing management as well as nursing diagnosis, you can list down these diagnoses and can give the treatment according to that. So first diagnosis is hyperthermia, that is related to infection. As there is an infection, there will be an increased body temperature. So you can assess the patient's condition, check for the vital signs, TPR, BP you can check. Record this temperature every 2 hourly in the TPR chart, as well as you can administer antipyretic as it is prescribed by the doctor. You can give a tepid sponge bath in case of the patient temperature is high, as well as you can advise the patient in if he is going into a cold stage, you can wear the blanket. If he is in the hot stage, you can remove the blanket and put on the fan. So, as there is a fever stages are there, depending upon the clinical feature, you can manage it. Next is multi-system failure, which is related to the infection. As there is the endotoxins which is produced by the Staphylococcus aureus and pyogenes, there will be a infection which will be spread to the body, all over to the body by a bloodstream, and all these system, liver, kidney, CVS, your blood, everything will be failed and immunity will be zero. So that time you can give antibiotics, high antibiotic like a penicillin, as well as you can give cephalosporins, treat the these bacterial toxins and kill the bacteria by antibiotics. Treat the patients with the proper fluid replacement therapy, and in case if he has developed ARDS, you can connect with the ventilator. Low blood pressure, that is mainly related to decreased cardiac outflow. So as I told, venous stasis will occur and there will be no proper venous flow back to the heart and decreased cardiac outflow. And as a complication, in case of the renal failure is happening, blood pressure is high. If the renal failure is not happened and at another side cardiac outflow is less, there will be automatically hypotension. You have to take the patient's vital signs and record it, and you can give the appropriate medication to improve the blood pressure, and you can infuse the fluid, especially normal saline, which can improve the patient's BP. Then comes some of the life-threatening conditions. So, risk for life-threatening condition, death can occur that may be related to multi-system failure. Respiratory problems also can happen because of there is a respiratory failure or acute respiratory distress syndrome is happening. So check for the patients, any vital organs are going to fail because there is a system wise features are shown, and according to that you can give proper treatment. Then knowledge deficit. So knowledge deficit usually happens because what is the cost we don't know, what is the treatment regimen we don't know. So you have to explain the treatment to the patient as well as ask the history and find the causes, and tell the patient this is the causes and that's why these things are happening. Educate about the treatment regimen. So good communication when you are maintaining with the patient, automatically his knowledge will improve and fear will be reduced. All the procedure has to be explained and proper consent has to be taken. This will make the nurse legally safe. So here I am concluding this topic, which is very important for your exam purpose. Go through this session once again and update your knowledge. I'll come with one more interesting video in next session. Till then, thank you. Bye.